Hello everyone. Today we will talk about de-Winter T waves. So de-Winter T waves, also called as de-Winter syndrome, it is a special equivalent of anterior STEMI. So ST segment elevation MI of anterior wall, if it happens, there is a special variant is called as de-Winter syndrome. So which is an equivalent of ST elevation MI. It is seen in around 2% of acute left anterior descending occlusion and is often under-recognized by various clinicians. So you can see here. So what are the features of a T-Winters syndrome? D-Winter syndrome is that you will have a ST depression and there is upsloping ST depression will be there. You can see here the J point is down and ST segment is depressed from the baseline. So ST depression of more than 1 mm should be there and upsloping ST depression should be there, followed by a long T wave. You can see a prominent T wave, which is almost more than that of the R wave. Prominent T wave should be there, and there should be absence of ST elevation. So there should be absence of ST elevation. So normally in ST elevation MI, what we see is ST elevation. So there will be no elevation of ST elevation, no ST segment. There will be upsloping ST segment depression of more than 1 millimeter, that is more than 1 small square. Then there will be tall symmetrical T waves in the precordial leads. You can see this tall symmetrical T waves in the precordial leads, that is V1 to V6. Then there will be also, there should be associated reciprocal ST segment elevation, because you can see here ST depression. Opposite lead, then in AVR you must have a ST segment elevation of around 0.5 to 1 mm. And this is a typical generally what we see is that afterwards, if you repeat that, so this pattern will be immediately either followed or maybe preceded by a ST segment elevation MI prefer. It is associated with total occlusion of the proximal left anterior descending coronary artery. So you can see here, this is a classical ECG showing this upsloping ST segment depression. You can see here the J point is down and ST segment upsloping ST depression is there, followed by a prominent T wave. Here also you can see there. So this is the ST segment depression followed by a T wave, which is more than that of the R wave. And you can see reciprocal slightly more than 0.5 to 1 mm of ST elevation in the AVR lead, and no ST segment elevation is there. So you may sometimes get a doubt whether it is STEMI or not. Actually, if a patient has classical symptoms and you find this type of ECG, you should consider this as ST elevation MI, and you should treat accordingly. So you can either have to do, you have to go for reperfusion either by primary percutaneous coronary intervention, or you may have to go for fibrinolysis if PCI setting is not available. So this is very important, which is often missed by many clinicians. So you should be aware of this de-Winter T wave. Thank you.